Have you ever sat in a dental chair and just wondered why on earth your dentist needs to know so much about you? It turns out, making sure your visit is safe is about a whole lot more than just your teeth. Oh, you know the feeling, right? You get handed that clipboard, and suddenly you're trying to remember the name of a medication you took 5 years ago. It can feel kind of personal, but believe it or not, that detailed medical history is one of the most important safety tools in the entire dental office. And the reason why? Well, it might actually surprise you. Let's start with this number, 1. What does it represent? You might think it's the number one cause of cavities, but in this context, it's something much more serious. This represents the single biggest reason for medical emergencies in a dental office. And it's probably not what you're thinking. Yup, it's anxiety, plain and simple stress. Just the thought of a dental visit can kick your body's stress response into high gear. It gets your nervous system all fired up, your blood pressure can spike, and your heart starts working overtime. So before a dentist even thinks about a filling, their top priority is understanding and managing that stress. So to manage that risk, your dentist has to become a bit of a medical detective. Their first job isn't to look at your teeth, it's to gather all the clues they need to build a clear picture of your unique health profile. And this detective work happens in 3 main ways. First, there's that written form we all know and, well, that we all fill out. Second is the conversation, the back and forth dialogue with your dentist. And third is a quick physical check, like taking your blood pressure. Each step gives them another piece of your health puzzle. And here's the absolute core of it. The entire reason for this investigation is to figure out one thing. Can your body and your mind safely handle the stress of whatever procedure is planned? It's all about getting ahead of any potential problems before they can even start. Now, that conversation part, it's not just small talk. Dentists often use a really simple but super effective framework, the 4 Ws. So for any health condition you mention, they're going to want to know when it was diagnosed, what treatment you got, where you were treated, and maybe why it happened. Let's make this real. Say you mention a heart condition. Your dentist immediately needs to know if you have a pacemaker or maybe stents, or if you're on a blood thinner. Why? Because that information directly changes what kind of anesthetic they can use and how they manage the whole procedure.
Or how about something like asthma? Your dentist is going to ask about your last attack, what your triggers are, and, this is a big one, if you brought your inhaler with you. Because the stress of the visit itself could be a trigger, and they need to be ready to help you right there, right then.
Okay, so the detective has gathered all the clues from the forms and the chat. The next step is to take all that information and turn it into a clear professional risk profile. This is where they put all the pieces together. To do this, dentists, just like surgeons and anesthesiologists, use what's called the ASA Physical Status Classification. It looks a little technical, but it's basically just a scale from 1 to 5 that grades your overall health. An ASA 1 is a healthy person with no issues. As the numbers go up, it means there are systemic diseases that are more and more severe. So how does this work in the real world? This example is perfect. You could have a 22-year-old who feels perfectly healthy, no medical history at all. But if they smoke a pack a day, they're automatically an ASA 2. That one habit is considered a mild systemic disease that the dentist absolutely has to account for. And this is where it all leads. This is the payoff for all that detective work. The whole point is to create a treatment plan that is custom-built to be safe for you. This is not a one-size-fits-all situation. Just look at this comparison. For a healthy patient, the plan is pretty standard. But for a patient with a heart condition, the whole game changes. Appointments might be shorter to keep stress down. They might limit certain ingredients in the anesthetic. They might even need to postpone elective work for a few months after a major cardiac event to ensure you're stable. These are real, life-saving changes based entirely on your health history. And this custom tailoring applies to all sorts of common conditions. For instance, managing a patient with diabetes requires a totally different playbook in the dental chair. So, for a patient with diabetes, your dentist will probably want to see you first thing in the morning, since blood sugar is often more stable then. They'll double-check that you've eaten and taken your meds to prevent a dangerous drop in blood sugar. They're trained to watch for subtle signs of hypoglycemia, like confusion or sudden anxiety. And they know that any infection in your mouth has to be treated super aggressively, because it can throw your whole system out of whack. So, when you step back and look at the whole picture, the detective work, the risk assessment, the personalized plans, it all points to a much bigger, much more important idea about what a dentist actually is. This quote really just says it all, doesn't it?
A technician might just focus on the tooth, but a doctor understands that your mouth isn't some isolated island. It's connected to everything else in your body. What happens in your mouth affects your whole system, and what happens in your system affects your mouth. So the next time you're filling out one of those forms, remember this. Your dentist isn't just being nosy. They are doing their duty as a healthcare provider to protect your total health. They aren't just a tooth doctor. They're a doctor of the entire oral system, which is basically the gateway to the rest of you. And that really leaves us with one final thought. Now that you know that every little detail you share helps your dentist build a safer experience just for you, what new clue will you give your medical detective on your next visit?